Hi, my name is Jennifer. In today's video, I will be discussing documentation. Documentation as it relates to information accuracy, quality, and reimbursement. The medical record paints a picture of the patient's current status, or it should. The data integrity should be up to date. It paints a picture of the patient's status, the treatment plan, treatment needs, expectations, the benefits of treatment. And this is so important in that whoever is providing care to this patient needs an accurate, up-to-date picture of the patient so we can get a continuum of nursing care and the optimal outcomes for the patient, for the progression of healing. That is an advantage with the electronic health record in that it should be able to provide up-to-date information across disciplines in varied settings. So information accuracy is important in that whatever is changing with the patient's status should also be reflected in the medical record. One important aspect is sometimes there's autofills. It becomes somewhat cookie cutter, and that's one thing that with information accuracy we want to maintain that the information that is entered into the medical record is not a carryover or a copy and paste, that it does continue to provide up-to-date information and status of that patient that is individualized and what is currently happening. The information needs to be per standards of care. It needs to be entered per your hospital policies, your standards of care, your hospital policy, maintaining HIPAA compliance with this information. Information should only be provided to the main healthcare providers that are treating the patient. The information given out or transferred across disciplines should only be the necessary treatment that is needed for that particular discipline to treat. That way we just maintain that the sensitive medical record, maintain confidentiality, things like that in regards to patient care. So making sure that we're following the standards of care as I discussed, HIPAA compliance, your hospital policy, because this information, accuracy, data integrity, it needs to flow. It needs to flow across disciplines, only appropriate abbreviations utilized, so all disciplines can read and understand the information. Should be, a common language within the healthcare. Everything that's happening should be able to paint, like I said, an accurate picture, a story. Anyone that would come in to read this information should be able to identify what is going on, what is needed, diagnostics being performed, things like that. And that peer reviews could take place, in-house audits, state reviews, JCO, things like that, that you're going to want to make sure that that information is available, that it is in as it is needed, and that it is accurate and per all the policies and standards and protocols that are in place, because ultimately there could be litigation that comes into play, and that health record has been subpoenaed, and so we want to make sure we maintain that information. Another aspect is quality, and these somewhat overlap in a way. They all are integrated within the documentation. They're all so very important to be available and to be accurate. Quality, it drives the information age. Quality, as it relates somewhat more to my practice, in daily reviews of medical treatment and things like that. We want to make sure that we're using evidence-based protocols. So we want to know that, that they meet a standard of care, that they have been utilized and shown effectiveness. We don't want to diagnostics being requested and being performed when they may not be medically necessary. We wouldn't want the patient to have to go through any unneeded treatment. Then we have to think about different kinds of issues that could result from any kind of invasive treatments that the patient otherwise would not have to have. It ultimately reduces risk. When we have quality, when we were providing evidence-based treatment, it ultimately reduces any kind of risk for issues, litigation risks, and again, with the quality measures in place, quality indicators, different kinds of maybe programs that come into play to ensure information is utilized appropriately, resources are utilized appropriately and up to date to provide the best optimal care available. So we have, as I discussed, information accuracy and data integrity in the medical chart, quality measures, and those also you can run into different kinds of reviews for those, for the quality measures, quality outcomes, trend reports, surveys, things like that, as it relates to quality, just to ensure that our medical record is up to date, that we continue to use evidence-based practice, and we're providing optimal care, and it is reflected in our documentation. A third component that I will discuss is reimbursement. These, like the others, are all reflective in documentation. Reimbursement can be looked at in regards to the documentation of certain codes. You have your ICD-9 to ICD-10 crosswalks that a lot of providers now are implementing both codes in their documentation. I know in the data sets that I use, they are, sometimes will crosswalk things, other times not. So you may have one area that you're using an ICD-9 and it needs to crosswalk over to an ICD-10 for like a treatment plan per se. So it's important that you are utilizing the correct codes. We have DRGs, the HCPCS codes. All of these can affect reimbursement, your primary diagnosis and secondary diagnosis. If the documentation reflects a certain patient status and the severity is worse than what the actual code is capturing, then we may not have an accurate code, which also will not provide an accurate reimbursement for that code. So it's really important that those are changed, let's say after a surgery, any kind of status change, that we have the most appropriate code attached to our treatment plans, attached to the chart, the billing, and of course that let's say a surgical report, the documentation of any sort reflecting those, the provider yourself adds into the medical record, it ultimately needs to reflect the aspects of the coding to be able to utilize that. So if documentation were reviewed, it would back up the codes, the documentation would. So the physician, it's a really important part that the physician is coding or documenting specifics and severity versus just a broad range code without any kind of information attached to that. So the coding is very big. Coding in your medical injury screens, if those are utilized, coding in your billing, coding in your primary, secondary, because all of these, per your payer sources, they, continued care, future care, looking at case mixes and things like that. Um, it could be a determining factor in the bigger picture of things for funding that you don't even realize. So these are very important. Also, certain combinations of codes can affect reimbursement, can affect, as we were talking about, quality, the quality of care, to make sure that certain codes may be more severe, which may, be tied to advanced treatment needs. And so these advanced treatment needs may trigger if the correct coding was attached to those, and they may be provided additional resources earlier on. They may be reviewed more frequently. Other vendors or secondary resources may be pursued for additional oversight, discussions over care. So the codes are so very important, and of course they also, as I mentioned, funding, regulatory type things that could be attached, reporting requirements, Medicare, things like that. Different kinds of payer sources may require certain information attached to these codes, the billings, the payer sources, and things like that. And so we have how coding and anticipated treatment for certain codes impacts the whole picture of the patient's medical record. So funding for facilities can determine the types of care that can be offered, the numbers of, maybe even staff that is associated with a particular facility that you work at, based on the information that is given, the information that is captured and utilized across all disciplines. And so if these are not being captured appropriately, then of course it affects quality again, because you may have these caseloads of patients, and the severity is not accurately portrayed, and requires a lot more nursing care, a lot more medical care, the severity of the care, all of these things that is needed. And ultimately you could have achieved additional personnel to take care of these needs, to take care of these higher risk patients, these more severe patients requiring medical care. So it's very important to have your up-to-date information, that it accurately reflects the picture of the patient at all stages, for any updates, and that the whole disciplinary team can provide the best care for the patient, so they can continue to see appropriate services that may be required because of whatever their benefits of treatment or their lack thereof. So they may need to try additional options. So the information, data integrity, continued information and data integrity is so very important. The quality that is associated with that, the continued quality, the evidence-based protocols, evidence-based practices that are used, or standards of care, making sure that they follow the medical record, the American Medical Association, your standards of care, your policies and procedures, that it all reflects an appropriate capture of the patient's needs and status, and just that the documentation continues to also reflect your reimbursement. So all the components of documentation, electronic health record, continue to improve with the electronic health record, the nature of it, that everyone can see, or all the treating providers can see an up-to-date picture. We just need to make sure that that documentation reflects this up-to-date picture, so the patient can get the optimal care, progression to healing, and we can give them quality care, appropriate service, provide appropriate services, and only medically necessary services for their treatment. So thank you so much for your time.